Each year, we recognize World TB Day on March 24. This annual event commemorates the date in 1882 when Dr. Robert Koch announced his discovery of Mycobacterium tuberculosis, the bacillus that causes tuberculosis (TB). World TB Day is a day to educate the public about the impact of TB around the world. Centers for Disease Control and Prevention (CDC), along with our partners and colleagues around the world, share successes in TB prevention and control and raise awareness of the challenges that hinder our progress toward the elimination of this devastating disease. The theme of World TB Day 2021, "The Clock is Ticking," conveys the sense that the world is running out of time to act on the commitments to end TB made by global leaders. This is especially critical in the context of the COVID-19 pandemic that has put TB progress at risk, and to ensure equitable access to prevention and care in line with WHO's drive towards achieving universal health coverage. In 2018, 10 million people fell ill with TB, and 1.5 million died from the disease, mostly in low and middle-income countries. This also makes it the leading cause of death from an infectious disease. What is the difference between tuberculosis infection and tuberculosis disease? There are generally two stages of TB infection. One where the bacteria can be spread and can cause illness, and one where the bacteria is in a person's body, but is not causing disease and cannot be spread. People with TB infection have TB bacteria in their bodies, but they are not sick because the bacteria are not active. These people do not have symptoms of TB disease and they cannot spread the bacteria to others. However, they may develop TB disease in the future. They are often prescribed treatment to prevent them from developing TB disease. People with TB disease are sick from TB bacteria that are active, meaning that they are multiplying and destroying tissue in their body. They usually have symptoms of TB disease. People with TB disease of the lungs or throat are capable of spreading their illness to others. They are prescribed drugs that can treat TB disease. Who is at risk for tuberculosis? Persons who are at high risk for TB infection include people who have been in close contact with a person with tuberculosis disease, immigrated from or spent a considerable amount of time in a country where there are high rates of TB, are homeless, injects drug, are living with HIV infection, live in congregate settings, and or have a medical condition that weakens the immune system. Overall, about 5 to 10% of infected persons who do not receive treatment for TB infection will develop TB disease at some point in their lives. For persons who have weakened immune systems, that risk is much higher than people with normal immune systems. What are the symptoms of tuberculosis? People with TB infection do not feel sick and not have any symptoms. People who develop TB disease have symptoms based on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs, and symptoms can include bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, weakness, fatigue, weight loss, chills, fever, and night sweats. How is tuberculosis spread? The bacterium causing tuberculosis is spread through the air. When a person with TB disease (TB) coughs, sneezes, speaks, or sings, the bacteria is put into the air. The bacteria can stay in the air for several hours depending on the environment. Prolonged exposure to the tuberculosis is normally necessary for infection to occur. People with TB infection are not able to transmit to others. What can be done to prevent the spread of tuberculosis? People with TB disease should be excluded from school, daycare, or the workplace until the sputum is negative, about 2 to 4 weeks after the beginning of treatment. All household and close contacts of a person with active TB disease should be screened using the TB skin test or TB blood test for evidence of infection. All contacts with evidence of infection should be evaluated by a physician for disease. Routine screening of people who are at high-risk populations may help to diagnose TB infection. By treating TB infection, people can prevent the chance of developing TB disease and reduce the risk of infecting other people. Write in the comment section, what is tuberculosis? Do SLCS, subscribe, likes, comments and share. Press the bell icon for more updates. Keep watching, join and learn with us. Upgrade your skill and boost your career. We will meet soon. Take care.